was quite a shock to being diagnosed with any kind of cancer, and certainly with one of the most fatal ones.
So I was living like on the edge of life for 6 months.
For many patients, Tower Cancer Research Foundation is the place they turn for help. Tower is a leader in some of the most progressive thinking in the battle to eradicate cancers and blood disorders.
Our foundation's mission and vision are to offer cutting-edge clinical trials, be on the frontier of cancer research and community outreach. One of the great things about this organization is that we're nimble and we're quick.
Hope, healing, and humanity are what the foundation is all about. We endeavor to give hope to patients who are hopeless. We endeavor to heal these patients for patients who are potentially unhealable. And we want to do it in a setting that's compassionate and empathetic at the same time. And the foundation has been set up to do just that.
Founded just over a decade ago, the Tower Cancer Research Foundation has greatly improved patient access to new agents and methodologies and helps patients to better understand their treatment options.
Our patients don't have a lot of options when they go onto clinical trials. Many of the patients have failed standard effective chemotherapy, and their disease is continuing to get worse. Tower Cancer Research Foundation was started in order to make available to our patients state-of-the-art clinical trials that they would need to go to other cities to obtain.
As the vanguard of some of the most promising clinical trials in cancer treatment, Tower Cancer Research Foundation has often become a patient's greatest ally.
I have what they call stage 4 pancreatic metastasized cancer. There are essentially 3 options. I could be made comfortable, and my survival would be probably 60 to 90 days. I had a second option, which was standard chemotherapy, and the third option was to go into a trial with an experimental drug plus the standard chemotherapy. I chose the clinical trial option because there was some hope that it would double the effectiveness of the chemo and provide a 60% chance of improvement rather than a 30% chance.
As of right now, things are looking fantastic.
I couldn't be happier. I have no way of knowing how it would have worked without the trial, but the trial obviously is working splendidly. My passion in life primarily is my wife. I would be more than thrilled if I could live for a couple of more years.
Tower Cancer Research Foundation's clinical trials in cancer and hematology research are leading to potential remissions and possible cures.
I woke up on Thanksgiving with what's called petechia, red spots all over my skin. And then the next day after that, I woke up with blisters inside my mouth. I have ITP. It's either immune thrombocytopenia or idiopathic thrombocytopenia. My blood was like water. If I got a cut, it would take all day to stop it. And the big fear with that is internal bleeding. If I just bump my head slightly, I could have brain hemorrhage. It's definitely a fear having my kids climbing all over me. So there's not that many treatments out there for what I have. I searched for every alternative therapy. I went down the list of 5 things before I found this place and found this treatment. The drug I take is called AMG 531. Forces your body to create more platelets. Works totally different than everything else, and that's why I was very excited about this study. Felt very relieved the day I came in and the study had started to work. It was like the most exciting drive up to LA and San Diego. Tower is definitely the only thing that's helped me. It's the only choice I have. Being scared that I could possibly die at any moment definitely made me focus on my children a lot more. My family is definitely the most important thing in my life. My kids are the reason why I strive so hard to find an answer to what was wrong with me.
My relationship with the physicians in that practice and at the foundation go back over 25 years. By working on clinical trials together, they represent what we hope is going to be the new and more successful treatments. This allows patients to realize they're getting not yesterday's treatment, but they're getting really the best we know how to do today and maybe even tomorrow.
And success in clinical trials is closely tied to support of some of our country's leading researchers.
Clinical trials are the lifeblood of cancer therapy. Collaborations with other institutions are essential. We have affiliations with institutions such as TGen with City of Hope and many of the large pharmaceutical companies.
With the fellowships we have here at UCLA through the Tower Cancer Research Foundation, we've had a great interaction. They have been able to provide resources to train new fellows, new clinicians, new scientists that are ready to take on the new cancer therapies, and that's been invaluable.
From support groups to the Patient-to-Patient Bosom Buddies program, nutritional care, and community lectures, the Tower Cancer Research Foundation touches patients no matter where they are in their pursuit of a normal life.
You can't just treat the body and not treat the emotions and not treat the spirit.
I think of these women as survivalists. It can be a really lonely place, a very scary place out in the middle of nowhere, but this group has become our base camp, and we come here every week and we restore ourselves.
And the Foundation's dedication to community outreach continues to expand.
One of the things that we're very excited about is called the Lipin Project. And the Lipin Project is a information bureau.
Ronnie Lipin TCRF Cancer Helpline. This is Phyllis. What can I do to help you?
You know, a lot of people who get cancer get scared because they don't know where to turn to. What we're trying to establish is a place where you can go to get your questions answered.
As the Tower Cancer Research Foundation breaks ground in advanced medical treatments, through it all, Tower staff never loses sight of the human perspective, treating the patient with dignity, empathy, and caring.
I'm very passionate about the work that I do at the Foundation because I'm a survivor myself. What I would like to see for the future is more clinical trials, more research to help patients with cancer move along the road of life.
To see patients that are previously would have had death sentences that continue to live for very long periods of time and potentially be cured, there's nothing more gratifying than that.